Hi, I'm Dr. Eong Kah Guan, and I'm from the International Eye Cataract Retina Center. I'm an ophthalmologist, and my areas of practice includes vitreoretinal surgery, cataract, general ophthalmology, myopia, and dry eye and blepharitis management. There's currently a trend in which we see younger and younger people having cataract surgery. There's several reasons for this. One of the reasons is because of the high prevalence of myopia in our population. As we know, over the last few decades, there's been an epidemic of myopia, resulting in many young adults now having high myopia. High myopia is associated with increased risk of cataract. And for that reason, we are seeing more and more people presenting with cataract in their 40s and 50s. The higher educational level of our population, as well as an increase in expectation, has led to many patients not tolerating poor vision. As a result, they seek treatment for earlier vision impairment than would have been in previous generations. Because of the excellent results that modern cataract surgery can produce and the safety of this cataract surgery, more and more patients now have earlier surgery. Besides restoring the clarity of the vision, they can also reduce their dependence on glasses. For example, a patient who is highly short-sighted may not need to wear glasses after cataract surgery. Eye surgeons nowadays can tailor the treatment plans based on the individual's lifestyle and needs. Some patients, for example, prefer not to wear glasses after cataract surgery. For this to happen, they can opt to choose monofocal lens with monovision option or a multifocal lens. Some patients also choose lenses which give extended depth of focus, called an EDOF lens. Cataract surgery is the most common major surgery in the world, and modern cataract surgery can restore vision in most of these cases. The risk of cataract surgery is low, and usually the procedure is relatively painless. It doesn't require suture, and there's little bleeding, and the risk of infection is also very low. In general, it's usually an operation with a very good outcome. In the old days, cataract surgery was not so advanced, and as a result, the outcome is not necessarily very good. And as a result of this, most surgeons would not do cataract surgery in its early stages. Instead, they would wait for the cataract to advance to a more severe stage in which there's severe visual impairment, and then they perform cataract surgery. For this reason, many patients believe, even now, that cataract needs to be fairly advanced or ripe before they can have cataract surgery. This is no longer true. Currently, modern cataract surgery is very advanced and they can produce good visual outcome with very low risk and a high safety margin. As a result, there's no need for anyone to wait for the cataract to be mature such that vision impairment is severe. A patient with severe vision impairment has a high risk of falls, hip fractures, road traffic accident, other injuries, depression, and even earlier death. Therefore, it is unwise to live with impaired vision if this impaired vision can be corrected. Medical treatment can restore vision in most patients and improve the quality of life. Anyone with any visual disturbance or impaired vision should seek the help of an eye care professional. The eye care professional can conduct a thorough eye exam to determine the cause of the poor vision, and if cataract is found, this is usually good news as cataract surgery will usually restore vision back to normal.